So childhood. So consider what thoughts or memories come to mind when you think about this word. I think, Clifford, the big red dog. I think about playing outside with my sisters when we were growing up and riding bikes all over the neighborhood. And I remember feeling very carefree. And when I asked my own kids what this word brought to mind for them, my 12-year-old daughter said celebrating birthdays. And my 9-year-old son said, well, childhood was fun until school started. And I said, I need a better answer than that. And he said he enjoyed playing sports with his friends. And I hope that for many of us, we have very positive memories of childhood. But there are children that struggle. In North Carolina, 1 of 5 children have had one or more emotional, behavioral, or developmental concerns identified. And between 11 to 20% of children in the United States have had an emotional or behavioral diagnosis made. So I feel that as a pediatrician, it is important that we identify these challenges that may affect our children's ability to function well at home, at school, and in their community. In my pediatric office, I think we do a great job of screening our children from birth to 5 years of age for developmental and social concerns. At each well-child visit, we talk about gross motor, fine motor, personal social skills, and communication abilities. And for adolescent patients ages 12 and older, we do an annual screening for anxiety and depression. But we were missing that group between 6 and 11 years old. We didn't have a formal assessment tool in our office for psychosocial concerns. So the goal of my project was to identify a screening tool for children ages 6 to 11 that would address those psychosocial concerns. So I started by defining the steps that I needed to take in order to complete the project. So the first step was to research and identify that tool to use in clinic. The next step was to implement that screening tool into workflow. And then lastly, it was to evaluate the results of the screening tool and obtain provider feedback. So for the initial step, I reviewed guidelines published by the American Academy of Pediatrics about appropriate screening tools for children ages 6 to 11 years old. The Pediatric Symptom Checklist is an approved screening tool for children of these ages. It is a reliable and validated screening tool that was developed by the Department of Psychiatry at Massachusetts General Hospital. It has been used in other cultures and countries and comes in a variety of different versions. So there's a pictorial version for younger children, a parent form to complete, as well as a youth version. I chose the parent form, which consists of 35 questions that ask about an array of different childhood behaviors. The Pediatric Symptom Checklist has also been recognized by the National Quality Forum as one of 15 endorsed child health measures and the only one that assesses child mental health issues. So the next step of my project was to provide training sessions for both the providers in the office as well as the clinical staff about the Pediatric Symptom Checklist and the instructions for scoring. In our office, this checklist is given to the parent at the start of the visit, and while the child is being worked up for the visit, the parent completes the form. Our clinical staff then scores the checklist and has it for the provider to review before we walk into the visit. And I found it very helpful to be able to look at the concerns that some parents had before walking into the visit. It helped me to understand the potential complexity of the visit. And then I made sure that I was addressing those concerns. Parents have the option of responding with never, sometimes, or often. And those columns received a score of 0, 1, and 2, respectively. If more than 4 questions are left unanswered, the screen is considered invalid. And the scoring range is from 0 to 70. A score of 28 or higher indicates a positive screen. A score of 28 or higher occurs 5 to 20% of the time and identifies roughly 12% of the population. The final step of our project was to review the results of the screening tool. In our clinic, I initiated the project in January of 2017 and spent 6 months collecting the checklist. Over the course of 6 months, I collected 625 checklists. 31 screens were positive. Some of the common diagnoses associated with positive screens include attention deficit hyperactivity disorder, learning disabilities, autism, anxiety disorders, and mood disorders. So our results were on the lower end of what may have been anticipated. We identified 5% of our population. And a few things that may have contributed to this result include, one, that I initiated the screening tool during the winter months. And in pediatrics, we had a very full and busy winter. So we had fewer well checks overall during those initial winter months as compared to the summer months. Our office also transitioned to a new electronic medical record system in December of 2016. And with that transition, we lost the ability to have patient phone call reminders for appointments. And so I think overall we've had a slight decline in our number of well child visits. Third, I also screen a population that I feel is stable both socially and economically. And so perhaps they have fewer risk factors for developing specific psychosocial concerns. And lastly, I do feel like some parents don't recognize certain behaviors as significant concerns. And so I would have a negative screening checklist, but then when I would walk through the visit and talk about school performance and friends and life at home, then different challenges and concerns would arise. And after many years in practice, I am still consistently surprised by what families and children are dealing with, and they don't tell you about it unless you ask first. And I definitely had screens with scores between 21 and 27 where the child had a known diagnosis of Asperger's, autism, learning disabilities, or significant anxiety. So with identifying just 5% of our population, if you combine the groups that scored greater than 28 and the groups that scored 21 to 27, that identifies 12.7% of our population, which is a little bit more in line with the national data. And it is recommended by the folks that developed the screening tool that if you have 5% or fewer positive checklists, or on the other end, 25% or greater positive checklists, then you may want to reassess what that total score is that indicates a positive checklist. So in different cultures, they have adjusted the value of 28. And in other communities in the United States with varying risk factors, they have adjusted that endpoint. I think this is something that we need to collect more data for and need to have further discussion with my partners and colleagues and perhaps other practices in North Carolina that use the pediatric symptom checklist. I also wanted to obtain provider feedback. I sent out a short Google survey to my partners and wanted anonymous replies. I wanted their honesty. And so overall, the majority of providers did feel that use of the pediatric symptom checklist was helpful in identifying psychosocial concerns for children 6 to 11 years of age. The majority of us did feel like we were able to discuss those concerns at that visit, which is always a concern once you introduce a screening tool. You worry that you might not have enough time to address the concerns that are brought up. But we felt like we did a pretty good job. And we also felt like we were able to provide the resources during that visit as well. So if they needed further evaluation, referrals to other specialists, or further management, we were able to do that. So I do feel like in the last 6 months, I was able to successfully identify and implement a screening tool for children ages 6 to 11 years old for psychosocial concerns in our clinic. We're going to continue to use this screening tool in our clinic, and we're going to continue to evaluate the results and then continue to have further discussions about the total score, which indicates a positive screen. And I wanted to add that over the last 6 months, as I have been working on this project, I have cared for a 10-year-old girl with a severe eating disorder. She had restricted herself to 1 meal a day, and she's now in inpatient therapy for that eating disorder. I have a 9-year-old girl with a specific phobia of severe weather, so much so that she had difficulty getting to school in the spring. And then a little 8-year-old boy with significant learning difficulties in school that has led to school performance anxiety. And all of these struggles that the children have affect the whole family. And so I feel very strongly that it's important for us to identify these challenges that the children may face so we're able to provide the support and the care that they need so that they can have a happy and healthy childhood. Thank you.